When patients are inquiring about Invisalign, we always talk to them about all of the stages involved, and one of them is the final stage, which is retention. So this is often overlooked, or if you had braces as a teenager and your teeth have relapsed, they've moved back, it's often due to lack of retention after your treatment. So it's a really important conversation that we have with every patient. So how do you manage that for your patients, Katie?
I'm going to use the term supervised retention. So all of our Invisalign packages include retainers. So you'll definitely go away with 3 sets of Invisaligns Vivera retainers. And if you are a suitable candidate, a bonded retainer, which is a small metal wire bonded behind your teeth that you can't see when you smile. If we go back to why your teeth were straightened in the first place, your teeth were straightened because your teeth had moved or they weren't in the correct positions in the first place. All of our bodies change over time and our tooth positions change slowly over time. And so that when you have straightened your teeth, first of all, they're going to want to bounce back to where they've come from. So you have to wear retainers to stop them wanting to go back, like spring back like an elastic band to where they've come from. And then when that sort of need to want to bounce back goes away, they are still teeth in your mouth and in a mouth that you use, and you have the same habits that you had before you had your Invisalign. And over people's lifetimes, teeth do carry on moving a little bit. You also use your teeth. So if you have bonded retainers on your teeth, you've essentially got a wire bonded with little dots of composite that you are then chewing with your teeth. So you can have deterioration of either the wire or the composite holding the wire. So your bonded retainer, probably after it's been in your mouth for some time, is not going to be as in good a condition as when it was placed. So that might need either replacement or some reconditioning to sort of re-tie in the bits of wire. And your removable retainers, if you are wearing them every night, you can look after them by using like an ultrasonic pod, such as a Zima pod. But if you're wearing them every night, eventually, if you're wearing them for 365 nights a year, they're going to pick up wear and tear. They're not going to be as nice as when you first had them. And so eventually you're going to want to have replacement retainers. If I don't see you after you have finished your Invisalign appointments, I don't know if your teeth are still in the correct position, so I can't advise you when you might need to have some maintenance of your bonded retainer, when it might need to be replaced, or I can't inspect your removable retainers. So I know I've waffled on, but if you are planning on investing time and money into straightening your teeth, if you want them to stay as close as possible to your final result, you need to carry on seeing the provider who places them, so that when you are a year or 2 out of your Invisalign treatment, we can then keep on keeping your teeth straight.